Welcome to the Omni Dental Podcast.
It's great to be here.
I was standing in front of the mirror this morning, doing the usual routine coffee in one hand, toothbrush in the other, and I found myself just staring at my teeth.
We all do it.
And I realized something. We are totally obsessed with the white and straight part of the smile, aren't we?
Oh, absolutely. It's the Hollywood standard, the first thing you notice.
Right. When we hear cosmetic dentistry, that's exactly where our brains go. We think about blindingly white veneers. We think about invisible aligners.
Bleaching trays, all of it. It's all about the architecture of the tooth itself.
Exactly. But today we are diving into a stack of research that suggests we might be staring at the painting while the frame is, well, rotting away. We're talking about gum health.
The frame is really the perfect analogy there. I mean, you wouldn't buy a priceless painting and then staple it to a piece of cardboard.
I certainly wouldn't.
And yet, biologically speaking, that is exactly what happens in dentistry more often than you'd think. People invest thousands in the art, the veneers, the crowns, but they completely neglect the canvas it sits on.
So today we're unpacking a really fascinating article. It's titled The Role of Gum Health in Cosmetic Outcomes by Dr. Billis Poles, dated January 31, 2026.
And to see how this theory actually plays out in the real world, we're also looking at the philosophy and practice of Dr. Poles himself at a place called Omni Dental and Med Spa in Arlington Heights, Illinois.
Okay, so we have the theory and the real-world application.
Exactly, because theory is one thing, but seeing how a clinic actually integrates this gum-first mentality, well, that's where it gets interesting.
So the mission today is basically to convince you and me, because I'm definitely guilty of ignoring the pink stuff, that cosmetic dentistry is actually about 50% gum health.
I'd argue it's even more. Maybe, I don't know, it feels more like the prerequisite, the foundation.
That's a bold claim. So reading this, I was honestly surprised by how much the health of the gums dictates the success of all that expensive white stuff we all want.
It's biological, it's
Yeah.
mechanical, and it's aesthetic. If you don't get the gums right, the expensive cosmetic work doesn't just look off. It can actually fail. Like physically fail.
Okay, that sounds expensive and painful.
Yeah.
So let's unpack this. The source material uses a really strong argument about foundations to kick things off.
Right. Think of it this way. Imagine you are building a custom-designed luxury home. You've hired the best architect. You're importing marble from Italy.
Sounds like a dream house.
It is. The blueprints are a masterpiece. But then you decide to build this magnificent structure on a swamp.
Not the best real estate choice.
A terrible choice. The ground is soft, it's wet, it shifts constantly. It doesn't matter how expensive that Italian marble is if the foundation cracks and the house starts sliding sideways into the mud.
I can see the visual. So the house is my cosmetic dentistry.
Your implants, your bonding, your veneers, and the swamp. That's unhealthy, inflamed gum tissue.
That makes total sense. But let's get into the biology of it. Because a house is static, but teeth are alive, right? The text says gums aren't just there to look pretty.
Not at all. They are incredibly active tissues. We tend to think of gums as just skin in our mouth. But according to Dr. Pole's article, healthy gums are essential because they provide a stable foundation in two very specific ways. First, they promote strong blood flow.
Which is key for healing.
Crucial. Let's say you're getting a dental implant. That's a major procedure. You are introducing a titanium post into your jawbone.
Which sounds intense when you put it that way.
It is a surgery. For that implant to work, it needs to integrate with your body. There's a term for it. Osseointegration. The bone actually grows around the metal.
And the gums control that.
Well, the gums supply the blood, the oxygen, the nutrients to that site. You need that surrounding tissue to be vibrant and vascular. If the gums are diseased, that blood flow is compromised. It's like trying to water a garden with a kinked hose.
The resources just don't get there.
Exactly. And the text also mentions physical stability, a seal.
Okay, what does that mean?
This is the second function. Gums physically stabilize everything by creating this tight seal around the net of the tooth. Think of it like a gasket in an engine.
Okay, keeping the fluids where they belong.
Precisely. This seal prevents bacteria and food particles from sliding down the side of the tooth and attacking the bone underneath. If that seal is broken by inflammation, if the gasket blows, bacteria get in, and the foundation starts to erode.
It's the aha moment for me. I always thought cosmetic dentistry was, surface level work, like painting a car.
That's a great comparison.
You sand it down, spray it, and it looks new. But it sounds like it's more like rebuilding the engine first.
Exactly. You can paint a car with a cracked engine block, but it's not going to drive very far. And this brings us to the risks.
Yeah, let's talk about when good cosmetics go bad, because the article specifically highlights two big procedures: dental implants and dental bonding.
Two of the most common cosmetic procedures out there.
And the villain in this story is our old friend, periodontal disease.
The silent killer of smiles, for sure.
So implants first. You mentioned the swamp failing to hold the house. Biologically, if I have untreated gum disease and I get an implant, what actually happens?
So the text is very clear on this.
Yeah.
It leads to bone loss. You see, periodontal disease is an inflammatory condition. Your body is fighting a war against bacteria, and when that war drags on, your body produces chemicals that actually break down your own bone to move away from the infection.
Wait, the body dissolves its own bone.
It's a defense mechanism called resorption. But for an implant, it's catastrophic. An implant is anchored in that bone. If the bone recedes, the implant loses its support. It's like a fence post in loose, sandy soil.
It wobbles, and then it fails.
It fails. So you could spend thousands of dollars on an implant, go through the whole surgery, and because the gum disease wasn't treated, the implant just, well, it's gone.
Wow.
And sometimes before it fails, it just looks terrible. The text describes gum recession.
Oh, I saw that. That's when the gum line pulls back, right?
Yes. Now imagine you just paid for a beautiful crown that matches your other teeth perfectly. But then the gum recedes 3 millimeters.
So now you can see the root of the tooth.
You see the yellow root surface, or even worse, the dark metal collar of the implant. You paid for a seamless, natural look, and now you have this jagged, exposed line. It ruins the aesthetic completely. They call them black triangles, those little dark gaps between teeth where the gum has died away.
That is a nightmare scenario. You're trying to look better, and you end up with something that looks unhealthy.
And it affects bonding, too. This is the second procedure the article warns about. Dental bonding is when they apply a resin to fix chips or gaps.
Right, a quick fix for a chipped tooth.
It can be, but the article notes that inflammation makes bonding less effective.
How so?
Well, think about it. Bonding materials are hydrophobic. They hate water, and they really hate blood. To get that resin to stick to your tooth for years, the surface has to be perfectly dry and sterile.
And if your gums are inflamed?
They bleed. Gingivitis means your gums bleed easily. If you have moisture or blood seeping onto the tooth during the procedure, the bond is contaminated. It won't hold.
It'll just pop off.
While you're eating a sandwich a week later. Exactly.
So the takeaway here is really clear. You have to fix the gums before you can get the smile makeover. It's the solution before the solution.
Precisely. And the article outlines what that looks like. It starts with professional cleanings, obviously, but for people with issues, it involves procedures like scaling and root planing.
That sounds intense.
Oh.
Scaling and root planing.
It's often just called a deep cleaning. The dentist goes below the gum line to remove the plaque and tartar that's causing the inflammation. They're essentially cleaning out the swamp.
Draining the swamp, so to speak.
You got it. You clear out the infection, the gums heal, they tighten up against the tooth again. Only then, once that foundation is stable, do you start building the house.
It puts a whole new perspective on the timeline. It's not a quick fix. If you walk into a dentist and say, "Give me veneers today," and they don't look at your gums.
I would say walk away, yes.
So now that we know what needs to be done, the next question is, who do you trust? Because you need someone who gets both the biology and the aesthetics.
Exactly. You need someone who sees the whole picture.
Yeah.
And that brings us to the profile of Omni Dental and Med Spa. We have their About Us documents here, and I want to talk about the vibe of this place first.
Okay.
Because med spa is an interesting word to see attached to dental.
It is. Usually med spa means facials and things like that.
It signals a shift in philosophy. Traditional dentistry can feel very clinical, sometimes cold. But when you see Omni Dental and Med Spa, located there on East Rand Road in Arlington Heights, it implies a connection between dental health and overall well-being.
The text mentions a relaxing environment and a patient-first mentality.
Which is actually clinically relevant. If a patient is anxious, they avoid the dentist. The gum disease gets worse. If you create a spa-like, stress-free environment, people are more likely to show up. And showing up is half the battle.
They also mention the family aspect, from toddlers to seniors.
Which suggests they aren't just a boutique for high-end makeovers. They are doing the day-to-day maintenance that prevents these problems in the first place.
So let's talk about the lead dentist, Dr. Billis Poles. What does his profile say?
Well, he has over a decade of experience, which is that sweet spot. He's seen enough to know what works, but he's still up on all the modern techniques. He specializes in general, cosmetics, and preventive dentistry. But what stands out to me are the words used to describe his approach. Friendly, precision, and conservative.
Conservative is a really important word in dentistry, isn't it?
It's the highest praise. A conservative dentist means their goal is to save as much of your natural tooth structure as possible.
So they aren't trigger happy with the drill.
Exactly. An aggressive dentist might say, let's grind down all your teeth and put crowns on them. A conservative dentist asks, how can we achieve this look while touching the natural biology as little as possible? It's an ethical stance. They don't do unnecessary work.
That builds a lot of trust.
It does, and to pull that off, you need the right tools. The source mentions they use advanced technology. But there is one detail here that I found really unique.
I think I know what you're going to say. The eco-friendly thing.
Yes, they are an environmentally conscious dental practice.
That stuck out to me too.
Yeah.
Because dentistry is usually a mountain of plastic, gloves, bibs, barriers.
It produces a lot of waste. For a practice to explicitly commit to minimizing that impact, that tells you something about their attention to detail.
It's a proxy for care, isn't it?
I think so. If they care enough to figure out how to reduce their waste footprint, imagine how much they care about the margin of your crown or the health of your gums.
That is a great observation. It's a mindset of care.
And that connects back to the med spa concept. It's a holistic approach. The word omni means all or every. It covers the health, the beauty, the environment.
And speaking of Omni and reaching out, let's talk about the service area. Because while they are in Arlington Heights, they seem to be a hub for a pretty wide net of communities.
They are. The documents list Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, and Elk Grove Village.
That's basically the entire northwest suburbs of Chicago.
It is, and I think that speaks to the destination nature of this kind of care. If you are looking for that bridge between I need healthy gums and I want a superstar smile, people will travel for that.
It's worth a 20-minute drive to avoid the Swamp Foundation.
Absolutely. You want the expert who is going to tell you, no, we can't do veneers yet. We need to heal your gums first. That's the dentist worth driving for.
Now, Dr. Pohl's philosophy, as we saw in the article, isn't just about fixing things once they break. It's heavily weighted towards preventive care.
Which is the unsexy but vital part of this. The best cosmetic outcome is the one where you didn't need major work in the first place. The source material emphasizes regular visits and tailored treatment plans, not one size fits all.
Right, because everyone's biology is different.
Exactly. Your bone density, your immune response. A cookie-cutter approach creates problems. You need that tailored plan.
Before we wrap up, I want to leave the listener with some actionable advice. What does the source text say we should be doing right now to protect our gums?
It comes down to the basics, but doing them with intent. First, brush and floss daily.
Groundbreaking advice. I feel like I've heard that one before.
I know, it sounds cliche, but the text explains why. It reduces plaque. And plaque isn't just food, it's a biofilm. It's a colony of bacteria living on your teeth.
A colony.
A city. And if you leave it there for 24 hours, it starts to calcify into tartar. Once it's tartar, you can't brush it off. It's like concrete. So when you floss, you aren't just getting spinach out. You are conducting riot control.
Riot control. I like that. I'm going to think about that tonight. And the second point.
Don't wait on discomfort.
That's a big one. We're trained to think, no pain, no problem.
Exactly. But the text says, treat gum disease early to avoid complications later. Gum disease is often silent. It doesn't hurt until it's really bad.
So what are the early signs?
Pink in the sink. If you see a little blood when you brush or floss, that is your body waving a red flag. It's saying, hey, the seal is breaking. If you catch it then, at the gingivitis stage, it is 100% reversible.
Reversible is a good word.
It's the best word, but if you wait until it hurts, you're likely dealing with periodontitis and bone loss. And that is not reversible, it's only manageable.
That's a huge distinction.
Always be in the reversible camp. And looking at the Omni Dental contact info, they highlight that they handle emergency situations and accept new patients. So there's really no excuse to wait.
So let's summarize what we've learned. The perfect smile isn't something you just buy off the shelf. It's a partnership.
It is. It's a partnership between you doing the daily riot control and the expert, like Dr. Pohl's at Omni Dental, who provides the precision care and biological oversight.
And if you are in the Arlington Heights area or any of those surrounding towns like Schaumburg or Palatine, and you want to start that partnership, here are the details. You can find them at 305 East Rand Road, Arlington Heights, Illinois.
Or you can call them directly. The number in the source is 847-483-8833.
And of course, check the website. It sounds like they have a lot of resources there, and you can get a feel for that med spa vibe we talked about.
Definitely.
As we close this out, I'm thinking about the word luxury again. We started with the luxury house on the swamp.
The marble and the mahogany.
Usually when we think of luxury, we think of things that are static. A diamond watch, a sports car, they don't change.
Right, they are objects. If you park a Ferrari in a garage, it doesn't catch a cold.
But cosmetic dentistry, this is a luxury that is alive.
That is a really profound thought to end on.
Think about it. You can pay for the luxury of a perfect porcelain veneer, but unlike a car, this luxury is attached to a biological organism in you. It relies on blood flow, on immune response, on bone density. It's a living investment.
Exactly. And if you don't respect the biology, if you ignore the gums, the luxury falls apart. True beauty, in this case, isn't really about the porcelain at all.
What is it then?
It's actually just a sign of optimal health.
True beauty is a sign of optimal health. You can't fake the foundation.
You really can't.
Well, that's all the time we have for this deep dive. Check your gums, folks. They are doing way more work than you give them credit for.
Until next time.
See you then.